Thank you, everyone, for your attention and for the invitation to address this remarkable 21st century gathering on this wonderful platform. Lots to talk about today. I've been a practicing physician for almost 50 years. I graduated from the University of Illinois College of Medicine in Chicago. I've had postgraduate training in surgery, anesthesiology, internal medicine, and obstetrics, University of California, San Francisco. For the first 10 years of my medical career, I practiced blood and guts medicine in emergency rooms, operating rooms, urgent care centers. But 10 years into my practice, I changed my diet. My body responded beautifully. And from that point on, 1981 on, I've been focused on what my patients are eating for the reasons I'm going to share with you in a few minutes. And so I've been a nutritionally based physician ever since. And I want to hold up this lens for you to look through as far as what your patients are eating, because it may, once you understand it, it changes everything you see in medicine and may change the course of your medical career. So with that, let me start my presentations here. Let me play in the window there and increase the size there, and then let's hide the video panel and hide the floating meeting controls, and we're ready to go. Okay, the lecture that I'm going to give is what I've been presenting to medical students across the country for several years now, called What I Wish I Had Learned in Medical School About Nutrition. And when you ask about my profession, no question, I'm a physician. It's deep in my soul. Everything I do is through the lens of the doctor's eyes. And my mission, my job is to relieve suffering wherever I find it. That's what doctors do. And that's what nurses do and dentists do, all health professionals. We relieve suffering wherever we encounter it. But in recent years, I devoted myself to not only practicing medicine, but teaching my fellow physicians, especially the young physicians still in med school or recently graduated. Again, there's so much that they are graduating medical school without. That is a major deficit in their training and in their practice, which I'll be sharing with you. When I lecture the medical students across the country, I remind them of what the German philosopher Goethe said. He said, what you know about, you see. Once you know about something, you start seeing it everywhere. I mean, that's the essence of medicine, of medical training, of course. What you see in the operating room, you start seeing on the wards, etc. But whether you're learning the names of the birds or how to fly an airplane, what you know about, you see. And that's what I hope to accomplish with you in this next hour. So if you know more, you'll start seeing more. And when I stride up to the microphone in front of us, a university class of medical students, I tell them, especially those that are in the early years, you know, in pathology class, physical diagnosis, histology class, you're going to be learning how to diagnose and treat all these weird and wonderful diseases from smallpox to leprosy. And you need to learn that stuff. But when you get out in the real world, when you open the door, the waiting room in your medical office or the emergency department or outpatient surgery, wherever you're working, the people sitting in front of you as your patients are not going to have smallpox and leprosy, thank God. What you're going to see in this modern life is a large group of people with a small group of diseases. The majority of folks who are sitting there are going to be overweight, if not clinically obese. You're going to see blood vessel disease showing up as high blood lipids, high blood pressure. You're going to see rampant type 2 diabetes with scary high blood sugars, but not due to eating sugar per se. We'll talk about that. And then you're going to see a host of inflammatory diseases affecting every organ system in the body, in the lungs as asthma, in the intestinal tract as Crohn's disease and colitis, in the joints as inflammatory joint disease. You'll see autoimmune diseases like lupus. This is Western medicine in the 21st century. If you're going to Central Africa or down in developing nations in this hemisphere, you'll run into a whole different set of diseases determined by poverty and parasites, but that's not Western medicine at this point. Western medicine is focused on these major degenerative diseases I'm displaying for you here. And let me just talk directly to this wonderful particular audience. Whether you're going into medicine or not, it is important for you to understand what I'm going to be saying, because these diseases, these 10 diseases, are going to dominate the majority of their practice. It doesn't matter if you are a dentist dealing with diabetic patients and their gum problems, if you are the pharmacist dispensing insulin, if you are the nurse in either the hospital or out in the community, you're going to see these people. If you're a podiatrist, you're going to see the people with diabetic neuropathy. If you're an optometrist, you're going to see the retinal problems. If you're a physical therapist or an occupational therapist, you're going to be helping people recovering from strokes and amputations from these diseases. If you're a psychologist, you're going to be dealing with people with eating disorders. If you're a home health care worker, these are the people who need your help the most. If you're going into administration, if you're going to be running a clinic or a nursing home or in a hospital, you need to know these diseases and what you're looking at. They're going to take up the majority of your time and money. And if you're a chiropractor, a naturopathic physician, no matter what your specialty or your flavor of helping in the health professions, you need to know about these diseases, because this is what is going to take up the majority of your time and energy. Yet, when you look in the textbooks or online for the cause of these diseases, you run into two words that stop all further thought. It's an etiology unknown. We don't know the cause of high blood pressure. We don't know the cause of atherosclerosis. We don't know the cause of diabetes. And it's true, I concede that the molecular biochemists have not teased out every last little interaction between every gene and every enzyme. Yes, there's a whole world of knowledge that needs to be gleaned out from that level of understanding the life processes. But to say that we don't know the cause of these diseases implies that we don't, if we don't know the cause of something, we can't cure you. And so that reduces the doctor or the nurse or whoever it is to the role of managing your chronic disease. We'll manage your high blood pressure, we'll manage your diabetes, we'll manage your asthma. I don't know about you, I did not go into medicine to manage chronic disease. I wanted to cure people. And every one of these diseases are curable. Because if you don't come in with that knowledge, then the message you're giving your patients, if you're just practicing the usual palliative medicine, is you're going to be sick the rest of your life. You will always have diabetes. Once on insulin, always on insulin. High blood pressure, you'll take these pills the rest of your life. This is the message we give to our patients. You will never get better. What a dismal message to give your patient. No wonder so many patients are upset with medicine. So many doctors are leaving because their patients, they're all getting fatter and sicker. They all need stents. Yes, doctor, you don't talk to them about what they're eating. That's what you're going to see. But it doesn't have to be like this. Because the truth of it is every one of these killer degenerative diseases that take so much time, energy, and invoke so much misery in the people who have them, these are reversible diseases. Every one of us doctors who practice lifestyle medicine, we've got lots and lots of dozens and dozens of patients who used to be obese, who used to have high blood pressure, who used to have type 2 diabetes, who used to have asthma, who used to have colitis. These diseases go away with a proper diet and lifestyle, yet nobody's saying anything to the medical students about this. And it's an oversight that we just cannot let stand any longer. Etiology unknown. Really, doctor, take a look at what your patients are eating. And I wish when I was a first-year medical student so long ago, some wise attending physician or chief surgical resident sat me down and said, let's have an honest talk about the effects of your patient's daily diet running through their tissues meal after meal, what it really does to the body, because that's why they're sitting in front of you, doctor, obese and hypertensive and diabetic and clogged up and inflamed from what they're running through their arteries every 4 hours. So let's talk some science here. I'm advocating that individuals and our society migrate to a diet based on whole plant foods. You don't have to be 100% vegan. but the majority of what goes down your gullet need to have grown out of the ground and be eaten in a form that still looks like the plant it came from. Oh, that's a cucumber, that's a tomato, that's carrot. That level of minimal food processing. A whole food plant-based diet is nothing to minimize, because here's why. Let's say you eat this lovely diet based on whole plant foods. You have this nice colorful salad in the upper left. You have a bowl of hearty vegetable bean soup. You have this quinoa and zucchini boats, my steamed green and yellow vegetables. You eat a meal like this, and if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I draw 5 cc's of blood into a glass tube, let it clot, spin it down in a centrifuge, and you have a look at it. This is what it would look like. The red clot goes to the bottom, and the liquid part of the blood, the serum, rises up to the top. And this is what the serum should look like after you eat a meal, crystal clear. You can read newsprint through normal serum. This is what your blood should look like after a healthy meal. But you eat a meal from the standard Western diet, bacon and eggs for breakfast, a cheeseburger for lunch, fried chicken or pizza for dinner. You eat a meal like this, and say the burgers and fries here, the butter, the saturated fat in the beef, the butter fat in the cheese, the egg yolk and the mayonnaise and the vegetable oil and the fries, all this fat oozes out into the blood. And for the next 5, count them, 5 hours, the blood looks like this. This creamy appearance is called lipemia. It means fat in the blood. That's what the word means. Postprandial means after eating. So this is fat in the blood after eating. Now, I will grant that not everybody shows the fat this optically densely, but everybody has a wave of fat that goes through their bloodstream after you eat a fatty meal like this. How could you not? Where else is it going to go? And I was serious about that 5-hour number. Here's Kuhl's classic study. They give someone a fatty meal at hour 0, and they draw blood once an hour for 6 hours. They take those 6 blood tubes, put them one after another into a spectrophotometer to measure how milky the serum is looking. You can see the blood getting fattier and fattier and fattier and fattier. It takes the liver about 5 hours to begin to clear the fat out of the blood and bend that curve down. And during this time, when the blood is running thick with fat, evil things are happening to the body. The walls of the arteries are injured, opening the door to atherosclerotic plaque formation, that leads to heart attack and strokes. The fat flows through the abdominal fat stores and sticks there, increasing obesity. It clogs up the insulin receptors in the liver and the muscles, increasing insulin receptors, leads to type 2 diabetes. And the saturated fats are pro-inflammatory, so this fans inflammatory reactions throughout the body for 5 solid hours. Well, think of how most Americans run their eating day. They start their day off with an Egg McMuffin or something fatty, and for the rest of the morning, their blood is running thick with fat, arteries are injured, insulin resistance going up, inflammation going up, obesity increasing. Takes the liver till about noontime to begin to clear the breakfast fat out of the blood when time for lunch, and another wave of fat goes through the bloodstream. And all afternoon, the blood is running thick with fat, the arteries are injured, obesity is increasing, diabetes getting worse, big abdominal belly going up. Takes the liver till about 6 in the evening to begin to clear the lunchtime fat out of the blood, when time to visit the colonel and send another wave of fat to the bloodstream. And all evening, arteries are injured, obesity increasing, diabetes worse, inflammation going up. Takes the liver till about 10 o'clock at night to begin to clear the dinner time fat out of the blood, when on the way back to the bedroom, we knock off that half pint of ice cream and another wave of fat goes to the bloodstream. And the truth is, nowadays, when you open the door to the emergency room, waiting room or the surgical outpatient, wherever it is, the people sitting there looking back at you have blood that looks like this. Most people are keeping their blood fatty all day. Stuff never clears out of the bloodstream. Why? Because we do not tolerate hunger in this society. When you get at all munchy and growly, if you're home, you put your head in the fridge for last night's leftovers. And if you're out, you head for the convenience store or the restaurant and eat something. We are constantly postprandial. We stay in the postprandial state all the time. And our blood stays in more or less in this configuration long-term, day after day, month after month. Now, I'm focusing on the fat with those slides, but let me tell you, the fat is just a marker to tell you how long the effect of each meal changes the blood and the body. But there's a lot more in that bloodstream besides fat when you're eating the Western kind of diet. First of all, it's a high salt diet. There's salt in the meat, salt in the cheese, salt in the fries, salt in the pizza, salt in the chips. It's a high sodium diet. And all this salt not only stiffens the arteries and makes you retain fluid that raises blood pressure, but we're now learning that high sodium diets can trigger the Th17 helper lymphocytes that open the door to autoimmune diseases, lupus and such diseases. So a high salt diet, not a great idea. Lots of heart attacks and strokes and autoimmune diseases associated with it. And then there's sugar. Now, I'm not talking about a half a teaspoon of maple syrup in your tea. That's how sugar should be used as a flavorant. I'm talking about eating sugar as a food. When you eat a candy bar, a cookie, a piece of coffee cake, a Krispy Kreme donut, you're basically eating a big chunk of sugar, fructose, dextrose, glucose. And even if it's a vegan chocolate bar or cupcake, it's still a chunk of sugar. What is wrong with that? Well, the problem, and certainly when you drink cola drinks, you flood your tissues with sugar. Well, the problem is known to every baker. In the bakery, the baker, to make bread, combines carbohydrates, pastry flour, plus protein, wheat gluten, and combines them together and heats them up. When this happens, the sugars stick to the protein, they glycosylate the protein. And when you heat them up, it all oxidizes together, form this bastardized mass of amorphous protein full of free radicals called advanced glycation end products. Why is that a problem? Don't worry about the name. Remember the acronym. It ages you. I will show you in a minute. Now, this is called the Maillard reaction. Sugar plus protein in the presence of heat creates these advanced glycation end products, and that's what makes bread crust. And that's cool if you're talking about the surface of a French baguette or some chocolate chip cookies. That's fine. But with every cola drink, every candy bar, muffin, a tide of these sugars flood through your tissues and glycosylate proteins throughout the body. And your own body heat provides what the baker's oven does in the bakery. Your own mammalian body heat runs the Maillard reaction, the sugar plus your own proteins in the presence of heat creates evil changes. You don't want to run the Maillard reaction in the lens of your eye. It's a great way to give yourself cataracts. You don't want to run the Maillard reaction in the elastin fibers of your skin. It's a great way to turn your skin into an old suitcase. And you sure don't want to run the Maillard reaction on the inner lining of the arteries in your brain. That opens the door to Alzheimer's dementia. Here are arteries of people died at the same age. This person did not have dementia. This person had Alzheimer's. And you can see the difference in the artery walls. This is all full of these advanced glycation end products and cholesterol. There's a huge vascular component to Alzheimer's. So eating sugar as a food is a real toxic activity. You want something sweet, have a mango, have some grapes. That's cool. Don't be eating sugar as a food. And finally, there's meat. Notice that all these previous problems can be set off by vegan junk foods, okay? Just because you're vegan doesn't mean that you're not eating a whole bunch of fat and sugar and oils and salt. And I've got some overweight diabetic vegan patients with gout from a junk food vegan diet. It's not enough just to be vegan. It's got to be a whole food plant-based diet. But once you add meat to the diet, you are now adding an entire new layer of toxic molecules. And I could spend the rest of this lecture and another one on top of it, just going through these 9 items that flood through the tissue with every meat-based meal. I'll go through them quickly here. But remember that in America or in the West, every meal is meat-based. There's a piece of animal muscle in the center of every plate. If you don't have it there, hey, where's my protein? And whether it's the bacon for breakfast, the burgers for lunch, the chicken for dinner, we eat animal flesh essentially with every meal. Well, here's the reality of that. First of all animal muscle has cholesterol, and when you grill that chicken breast, when you broil that steak, you are oxidizing the cholesterol, and it's the oxidized cholesterol particles that are the most atherogenic, that burrow into the walls of the arteries, promoting plaque formation that clogs the arteries and kills the patient. The very act of cooking the proteins and the sugars in animal muscle creates a flood of reactive aldehydes, malondialdehyde, glyoxyl, acrolein. Yes, all that biochemistry you're learning really means something in the real world. Well, these are mutagenic aldehydes. They damage your genes. They mess you up. They open the door to everything from birth defects to cancer growth. New 5-GC, this is a sialic acid that only animals make. And it sets off inflammatory reactions throughout the body. And our paleo friends and keto friends are giving themselves a shot of new 5-GC 3 times a day and open the door to inflammatory conditions of all types. Then there's endotoxin from the gut of the animals. All animals pass through the slaughterhouse, even organic grass-fed beef. And when their intestinal tracts are pulled out, when the carcass is eviscerated, the gut contents spill all over, and there's a thin layer of pathogenic gut bacteria on every cutting surface in the slaughterhouse. So every steak and chop that leaves the slaughterhouse has a coating of E. coli and salmonella and shigella and endotoxin, all these nasty pathogenic microbes. The meat is wrapped up in clear plastic wrap, sent to the supermarket, where the ultraviolet light in the meat case kills the bacteria like it's supposed to. But when these bacteria die, their cell walls break up and they form this stuff called endotoxin, nasty stuff. Sets off blood clotting, suppresses heart activity, releases free radicals, sets off allergic reactions. There's nasty stuff. When you get to the intensive care unit, you'll see people dying of endotoxic shock. This is the same stuff. And endotoxin is heat stable. Grilling the burger does not get rid of the endotoxin. And so every chicken breast, every burger is coated with this stuff. Our meat-eating friends give themselves a shot of endotoxin 3 times a day. Trimethylamine oxide, this comes from the carnitine in the meat and the choline in the eggs. They summon up bacteria that eat carnitine and choline. They turn it into trimethylamine that your liver oxidizes to trimethylamine oxide. This is a molecule from hell. This drives cholesterol into the artery walls and sets off plaque formation in the arteries. Carcinogenic heterocyclic amines, very active cooking animal muscle, creates these potent cancer-causing substances that rub on the stomach wall, rub on the colon wall, find their way into breast tissue, prostate tissue, and the cancers are promoted. Insulin-like growth factor 1. This is a hormone, a growth-promoting hormone that your liver puts out. When you eat this, when you eat meat and flood your liver with all these amino acids, well, the liver responds by putting out a gush of this insulin-like growth factor 1, promotes growth everywhere in the body. Great if you're a growing child or a baby calf, not so great if you're a woman with early breast cancer or a guy with early prostate cancer. The last thing you want is high IGF-1 levels, and these folks keep them high with a meat-based diet. The heme iron turns red meat red. It increases the risk of strokes and cancers. And finally, these animals in the feedlots are fed bushels of grains that are sprayed with pesticides and herbicides. The water has lead and mercury and cadmium in it. They're given antibiotics and growth promoters. All these toxins accumulate in the animal's flesh. So by the time you bite into that burger or that chicken breast, now you're eating all the concentrated pesticides and herbicides that animal consumed. This is the reality of a flesh-based diet. This is what floods through the tissues of the body with every meat-based meal. I call it the postprandial red tide. And here are the major molecules that constitute this red tide. And the qualities of your blood as this tide flows through you. It's a fatty, salty, sugary, antigenic, acid-forming, mutagenic, carcinogenic, atherogenic, pro-inflammatory tide that is disrupted to every enzyme reaction in the body, essentially. Now, when a real live flood tide is running through your house, it's pretty shocking and disturbing. It's no fun to see your sofa float down Main Street. But what's really freaking you out about the flood waters in your house is what those dirty waters are going to leave behind. Excuse me. It's the stain of the flood waters into the walls, into the carpets, into the baseboards that make you wind up tearing everything out, tearing the walls out, redoing the inner tide of your house. It's the stain that's left behind by the tide. Well, this kind of diet, the red tide flowing through the tissues, leaves its own kind of stain and dysfunction that we'll talk about. The food effects over time create the health effects that you see in your patients. And we can't ignore that. My profession ignores it. We blow right past it. Like what our patients are eating has no effect on these diseases, when actually it's the major determinant of why they're sitting in front of you, doctor, or sitting in your dental chair, or sitting in your nurse's station, etc. If you eat a meal, if you want these meals 3 times a day, that's 1,000 times a year. You are flooding the red tide through your tissues. And so when you see the man with the clogged arteries with the angina in the emergency room, the type 2 diabetic person, the lady with the acne, the guy with the big belly, this is not bad genes. This is not just environmental stress. It's what they are eating. And we've got to call it for what it really is, the effects of the red tide over time. And so my medical colleagues that are promoting paleo diets and promoting keto diets because their patients initially get better, I'll say, doctor, are you really seriously? You're promoting a meat-based diet. You really are telling your patients to keep these molecules percolating through all their tissues and in all their enzymes and all their nuclei of their cells, hour after hour, day after day, month after month, year after year. Really? And then we're shocked when after years of eating this, the joints become inflamed and the arteries start to clog up and the gut gets leaky and then the lupus appears and that cancer that's sprouted out of your colon wall, just bad genes, I guess. Really, doctor, how can you say that as a scientist with a straight face? Now, my colleagues recommending paleo diets, like the caveman supposedly ate, though they did not, like every caveman had a mammoth in the freezer and they spent all day eating mastodon meat. It's not true. We lived on carbohydrates. We basically foraged for starchy roots and tubers. That provided most of the calories into the Paleolithic camp. But folks who leave the standard diet alone and go to a meat and veggie diet initially improve. And if you stop, because paleo says some things I agree with, and you stop the dairy and the oil and the flour products, and people get leaner. And the very act of losing weight lowers blood pressure, your lipids get better, diabetes gets better. And they say, hey man, paleo's the way to eat. Those cavemen knew what they were doing. They all died at age 40 and they had skin that looked like old suitcases, and they all got eaten by lions or leopards at age 42 if they couldn't, if nothing else got them. But the truth is, you pack that intestinal tract full of meat 2-3 times a day. We are plant-eating hominids. We've got fingers on our hands, not claws. We've got long intestinal tracts for digesting fiber, not short ones like your house cat has. We have enzymes in our saliva that digest starches. We have small mouths with flat grinding molar teeth and rotary jaws for eating these starchy vegetables and edible grains and grasses. We're clearly plant-eating creatures. We can handle small amounts of meat occasionally from time to time. But a flesh-based diet is a disaster for us. Witness, go to any hospital and see what they're treating, what they're operating on. And my fear is, and I tell them, my colleagues and their patients, don't get seduced by these earlier changes. Yeah, early changes when you adopt the keto or paleo diet. You'll lose some weight and you're going to see some things get better. But running a flesh-based diet through your body month after month, year after year, in my opinion, these folks are setting themselves up for an epidemic of colon cancer and heart attacks and strokes and autoimmune diseases, type 2 diabetes, their insulin receptors clog, they're spawning microbes in their guts that leads to inflammatory bowel disease. And I think this is a recipe for dementia. And my young colleague, oh, you ought to eat paleo, you ought to eat keto. I say, do you know what you are recommending? The adage we practice medicine by, do no harm, applies to dietary advice as well. You can hurt someone with bad dietary advice. And so I asked my colleagues, yeah, you may get an improvement in their blood pressure temporarily or their cholesterol, but what are you really brewing up in these patients' arterial walls? What are you really brewing up in their colon and their breast tissue and their prostate gland? And what are you doing to the arteries in their brain? You're going to be around in 10 years when this lady has her stroke from the carotid plaque that you engendered in her carotid artery from a meat-based diet. You're going to be around in 15 years and this guy passes his first bloody stool from the colon cancer. Your meat-based diet spawned in his colon wall. You'll be around when patients first start showing signs of Alzheimer's. Nah, you'll be off to your new cushy clinic appointment in Seattle or in Phoenix. You won't even see the results that this kind of dietary advice spawns. And I have great concern over that. Nobody's eaten a paleo or ketogenic diet, flesh-based, for decades. Nobody said this is a huge experiment. This is all drive-by medical advice. People have eaten plant-based diet for centuries. And if you look at the blue zones around the world where people live the longest, where there's the most centenarians, they all have one thing in common. They are eating plant-based diets. They are not 100% vegan. I'm not saying that. But the amount of flesh they eat, a little bit once or twice a week on the side of the plate, the majority of what goes down their gullets grew out of the ground, usually their own garden that they've grown. This creates lean, healthy people without these degenerative diseases. Now, if your patients are all plant-based, and the answer is, are your patients percolating all these things through their tissues? The answer is no. My vegan patients don't do this to their tissues. That is a profound difference. And yet we in medicine, we blow right past this. We practice medicine like what our patients are eating has no effect on these diseases they're bringing to us to treat. It's like in the Harry Potter movies, Voldemort, the arch villain, the name that must not be spoken. Ooh, don't ask about what the patient's eating. Ooh, that's cultural. They'll get upset. They'll get offended. Yeah, they were raised to eat meat and cheese. Yeah, that's true. We're Americans. We can eat whatever we want. Yeah, you can. But your arteries got something to say about that. Your colon wall's got something to say about that. Your prostate gland got one, your breast tissue got something to say about the kind of fuel you're running through that. And we ignore these effects at our peril, because here's why, young scientists. With the digestive system is so efficient that within minutes of eating anything, molecules of that mouthful of food are flowing through every cell in your body where your DNA lies unfolded. And the food molecules wash through your cells, they wash over your DNA, and they play your DNA like a piano. And they turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal changes us on a molecular genetic level. In this information age, it's not hard to understand that food brings in not only nutrients, it brings in information, and it changes us. And you don't need to be a geneticist to understand that the genes are going to be turned on by this hunk of grilled animal muscle and all the toxic molecules that are unleashed through the body. The genes are going to be turned on by this, which lead directly to aging, inflammation, autoimmunity, and cancer. the genes turned on by this piece of meat are going to be a totally different set of genes than are going to be turned on by this food. And with all the phytonutrients and all these lovely colorful vegetables washed through your tissues. And they are antioxidant molecules. They quench free radicals. They promote tissue repair. It's the difference between 1 and 0 in a flesh-based diet and a plant-based diet. The effects they create are mirror images of each other. Your genes may load the gun, but your diet and your lifestyle pull the trigger. What does that mean? You may have a genetic propensity. You may have cancer in your family. You may have the genes for disease. But whether that disease actually manifests in your body or your patient's body is largely dependent on the food flowing through those tissues meal after meal, month after month, year after year. There are other factors, absolutely. Lifestyle medicine deals with it. You gotta get enough sleep, you need some exercise, you reduce stress, pure water, etc. Absolutely, those are all important. But the food dwarfs everything when it comes to whether people are going to be healthy or sick. Here you see the effects of food directly on the genome. This left-hand panel here, this is the genetic readout of a man with early stage prostate cancer. And all these red dashes here, these are active oncogenes. These are cancer promoting genes. They promote cell division and tissue growth. This is the genome of someone with active cancer. This man went on a whole food plant-based diet for 6 solid months, ran nothing but salads and soups and curries and veggies and hearty stews and soups and no cheese burritos through his tissues. 6 months of bathing his tissues in all these phytonutrients and these antioxidants and cell stabilizers. 6 months later, they did another biopsy. Same man, same prostate gland, same readout. Okay, same genes are noted here. Look at all the red active oncogenes that have been switched off just by a change in diet. This is how effective a change in diet, a truly health-promoting diet can be. Every meal changes us in one of 2 ways. It changes either directly, epigenetically, like new 5GC turns on inflammation, but also the food you eat determines the microbes that live in your gut, and they will change you by the neurotransmitters they release and the inflammation they set off, the enzymes they induce. Food is so powerful, we cannot take it for granted. And yet, most doctors do, most patients do too. And to practice medicine or dentistry or podiatry or nursing, whatever you're practicing, without paying attention to the red tide your patient may be flooding through their tissues every day, puts you in the same position as the old fable of the blind man and the elephant. You probably heard it, a group of blind men come across an elephant, they each grab a separate part of the elephant. One grabs the leg and says, oh, the elephant's like a tree trunk. One grabs the tail, oh, the elephant's like a rope. One grabs the trunk, the elephant's like a snake. One grabs the ear, the elephant's like a fan. They all have hold of the same elephant, but none of them has the faintest clue about what a whole live elephant really is. Well, that's the problem if you're practicing medicine, just etiology unknown, and there's a lupus there, and there's a colitis there, there's an asthma there. That reduces you to the plight these men have, because that's where our beloved medical specialists are. The cardiologist sees the clogged arteries, the internist sees the high blood pressure, the physiatrist sees the sore joints, the endocrinologist sees the type 2 diabetes. The rheumatologist sees the lupus, the dermatologist sees the psoriasis, the neurologist sees the dementia, the gastroenterologist sees the colitis, the general surgeon sees the colon cancer. They're all looking for that magical common thread here. It all has something to do with oxidation and free radical. How could all these different diseases have these same underlying mechanisms? Makes me want to grab the biggest bullhorn I could find and go gather all the specialists in the stadium and yell at them. It's the food your patients are eating. If to ignore it, you're in the forest of fast food. It's all around you. That's why that patient sitting in front of you, overweight, diabetic, hypertensive, clogged up, and inflamed. But we don't ask about food. That's the one thing we totally ignore. Well, no wonder you wind up just treating symptoms. You ought to lose some weight, Joe. And you see the patients once a month, and you raise their dosage of metformin and beta blockers. If that's how you practice medicine, you're going to leave medicine. They're all getting fatter and sicker. That's right, doctor. If you don't deal with the underlying cause of why they're sitting in front of you, that's what you're going to see. Are you a scientist or aren't you? You want to heal these patients or don't you? If you do, then get real about the role of their diet is playing in their disease process. So I tell the students, when you open that exam room door and the patient's sitting on the exam table, it's never just you and the patient. It's always you, the patient, and the patient's daily diet for the past few years. That's why they're sitting in front of you. It's the food is the invisible sculptor that has sculpted the body that they are bringing to you to fix. And the real tragedy is by not recognizing is we don't disclose to the patient the most powerful tool they could ever have to reverse these diseases. If they get on a whole food, plant-based diet, the majority of these diseases melt away. It's just stunning what we see. The concept of disease reversal, these are reversible diseases. And I tell the doc, don't settle for anything less if you can help it at all. These are reversible diseases with a whole food plant-based diet. We are plant-eating hominids, honor our anatomy and our physiology, and these folks, you'll see them get better. Now, you may be thinking, what's this guy talking about? Where am I going to get my protein? What do you mean? How can you live with no meat? Well, let me tell you, ask any gorilla, ask any buffalo, any giraffe. The biggest, strongest, most powerful animals on the planet grow to massive 1,000-pound bodies without ever eating cheeseburgers. The protein is in the plants, okay? It's in the grains and the legumes and the beans and the peas and chickpeas and lentils and seeds and nuts and quinoa. It's full of protein. In fact, here's a nutritional analysis of a day of eating plant-based. Now you start out with oatmeal with some berries and some hemp milk or oat milk. Lunches and dinners have a big salad, colorful vegetable soup, there's veggie burger, sweet potato. For dinner, some bean burritos, some green and yellow veggies, and some berries for dessert. You take this day of eating, put it through the Chronometer Nutritional Analysis program. Here's what you get. Only 2,400 calories, very modest. These are clean burning carbohydrates. They turn into carbon dioxide that you breathe out and water that you pee out. This is a clean burning fuel with 84 whopping grams of protein. They usually recommend 50, 60 grams. Here's 84 grams of high grade protein with no meat and a very modest fat intake. Absolutely. It is completely sufficient in macronutrients. You need a little vitamin B12. We can talk about that, but that should not be a deterrent just because we're not drinking out of streams anymore where the B12 is really made. So why does this work? What's the magic of plant-based diets? Well, first of all, that deadly red tide that most folks eat in the standard meat-based diet flush through their tissues every few hours. When as soon as you adopt a plant-based diet, when you choose the bean chili instead of the beef chili, and all that implies. First of all, this huge molecular onslaught, gone. The onslaught stops. The body can now get on with its healing, which it wants to do. Every cell knows how to heal itself. And instead, with every bowl of vegetable soup, every salad, every Asian stir fry, every Mexican burrito, every mulligatawny stew, every plant-based entree you send through your tissues. First of all, there's a high water content diet that's going to make the blood less viscous, so it flows more easily. And all the green vegetables give rise to nitric oxide that dilates blood vessels. So you've got wide open blood vessels with more free-flowing blood that increases oxygen delivery to the tissues. The fats, you've swapped out the meat fat with arachidonic acid that sets off inflammation. You've exchanged it for plant fats full of omega-3s that suppress inflammation. As I said, you flood the tissues with antioxidants to quench free radicals. You change the microbes in the gut from the pathogenic Bacteroidetes species to the more benevolent Prevotella that have antioxidant and anti-cancer properties. Blood lipids get better, cholesterol levels fall, your skin oils change, body odor disappears, acne clears up, heavy periods and breast lumps fade away. High protein diets damage the kidneys. Kidneys begin to repair. Lungs breathe easier. On every level, every organ system benefits. I could spend days just giving you lectures on how a plant-based diet benefits every organ system, but believe me, it does. This is a disease-reversing diet, and every one of us who practices lifestyle medicine have patients like Emily, used to be 100 pounds overweight, type 2 diabetes, injecting insulin, on 3 blood pressure medications, one on a whole food plant-based diet, 11 months of eating the wonderful plant-based foods, and this Emily turns into this Emily. Normal weight, normal blood pressure, normal blood sugar, off her medication, no longer has diabetes, no longer has high blood pressure. When a person like this adopts a whole food plant-based diet, within days, the obesity begins to melt away. The arteries relax and open up. High blood pressures go down. The sore joints stop hurting. The psoriatic skin begins to clear. The asthmatic lungs don't wheeze so much. The migraine headaches start getting better. And they turn into normal, healthy people. And I tell the students, what greater gift could you offer your patients that to free them from the curse of disease so they can get on with their lives? I tell my patients I want to see you in 2 places only, at the health food store buying your tempeh and out on the bike path where I'll wave at you. That's the only place I want to see you. Of course, if you break your arm, come and see me. But by and large, don't be a professional patient. Go live your life, and a whole food plant-based diet and a healthy lifestyle will allow you to do that. So let me quickly go through some diseases. I'm just going to skim the top of this. Type 2 diabetes is from this high-fat diet clogging up the insulin receptors. So insulin doesn't allow sugar into the cells, so sugar piles up in the bloodstream. This is a reversible disease, type 2 diabetes, which is the most common type. A whole food plant-based diet unclogs the insulin receptors and the diabetes goes away. There's an art to getting people off their meds, off the insulin, but it can easily be done. Now, dermatology, it turns out that dairy protein is a major promoter of acne formation. You yank out the dairy, not only the lungs stop wheezing, but pull out a couple other things, the oils, sometimes soy, and skin like this can turn into skin like that. Psoriasis often improves dramatically as you change the skin oils, change the fats in the diet, change the protein, heal the gut wall. And the most dramatic are blood vessel diseases, especially in cardiology. Every 30 seconds in this country, someone grabs their chest and falls over with a heart attack and dies. And because this atherosclerotic plaque is building up in the walls of the arteries, sets off clot in here that stops the blood flow. And the cardiologists say, oh, this is a relentlessly progressive disease. Once you get this, nothing stops it. That's right, doctor. If you don't talk to them about their diet, that's what you're going to see. But the truth is, this is eminently reversible. You eat a whole food plant-based diet, especially the antioxidants in the dark green leafy vegetables, saturate into the walls of the arteries, neutralize free radicals. The plaques get smaller and smaller and smaller. The endothelial lining regenerates itself. And arteries that look like this. This is the left anterior descending artery in a man's heart with an angiogram dye running through it. The whole artery should be about this wide. These rat-eaten parts here are atherosclerotic plaques encroaching into the blood flow channel. This man went on a whole food plant-based diet, 22 months of salads and soups and greens and veggies and curries and all of that going through the bloodstream, melts away the plaque, and this artery turns into that artery. Same patient, same artery. This is the power of a whole food plant-based diet. Just doing a bypass graft from here to here doesn't, the fact is this man's got plaques throughout his entire arterial tree in his body. Just bypassing a small section does not cure the disease. Changing the patient's diet and lifestyle does. Dr. Caldwell Esselstyn wrote this in the literature, started in 1985, 40 years ago, we've known about this. And arteries all over the body open up, much to the delight of people at home. If you or anyone you know has bad artery disease, they got angina and claudication, they have heart attacks, mini strokes, get this book, Prevent and Reverse Heart Disease by Dr. Esselstyn, follow its advice to the letter, and you can have that plaque melt away as well. As I mentioned, everything that the problem with a meat-based diet are also the main risk factors in Alzheimer's. People who consume lots of these get lots of Alzheimer's. Could there be a correlation? But no one's mentioning this to the doctors. The young med students are so jammed up with learning basic physiology and anatomy and principles of internal medicine. They have no one diet. Send them to the dietitian. She'll deal with that. I'm up in the emergency room or up in the operating room doing real medicine. But what are they doing in the operating room? They're dealing with the infections and the infarctions and the amputations from what their patients are eating. So they're all dealing with nutrition-based diseases that could be reversed with a healthy diet without this invasive surgery, etc. But we're not teaching doctors about nutrition. We don't regard it as clinically important. We don't ask about it on the national boards. That's going to be changing. And finally, the doctors are eating the same stuff themselves in the hospital cafeteria. They're eating their burgers and their pizzas, and you wind up with doctors with a big pot belly and a pocket full of statins and beta blockers. Not a great example to set for your patients. I think it is unethical. It's outrageous that we withhold this information and condemn the patients to these invasive procedures where the grafts clog up if they don't change their diet. This is a bankrupt way to practice medicine, and it will not last in the 21st century. The patients are demanding the information, and so are the young doctors, and I'm happy to provide it for them. People say, people never change what they do, what they eat. Yes, they do. They're sick and tired of being sick and tired. This is my patient Ken, came to me with all on medications and problems. 12 weeks on a plant-based diet, dropped to 24 pounds, normal blood sugar, normal blood pressure, and he's off his medications. And so I tell the young docs, before you order another $1,000 scan, another $500 set of blood tests, stop. Ask the patient what they ate yesterday. And if it's full of burgers and buffalo wings, that's why they're sitting in front of you, doctor. Send the patient to the plant-based dietitian. Let her or him do the counseling. Let her show them the videos and show them the articles and visit the website and take them shopping. You see them back in a month and see if they're not lighter and leaner and healthier. That's how medicine should be practiced. I tell the young docs, you at least owe the patient my 4-page handout on the way out the door. Hey, by the way, you want to get rid of your high blood pressure? You want to get rid of your diabetes? You want to get rid of your lupus? Here, read my handout here, visit these websites, see these videos, read this article, and call Ms. Smith, the plant-based dietitian, and come back and see me next month. And I've uploaded this to Susan Chen. She has my handout here. She'd be glad to give it to anybody who asks. And finally, the most important thing is we got to talk about what's happening on planet Earth. You may or may not be aware of it, but the sword of Damocles of doom is hanging over your generation. And it's largely due to what we are putting in our mouths every day. So the folks who are advocating, everyone should be eating paleo. I say, are you seriously advocating a flesh-based diet meal 3 times a day for 8 billion people on planet Earth? It will destroy this planet. Because the truth is, large-scale animal agriculture is the #1 driving force behind every single environmental disaster we are facing. That's why they're cutting down the forest to make grazing land and croplands for beef. The soils are eroding off. Corn and soybean fields, growing animal fodder, shovel down the gullets of cows and pigs and chickens to make cheap burgers and pork chops. Most water in this country goes to irrigate alfalfa and corn and soybeans, not for city use. Most water is polluted not with city sewage, but with animal manure and pesticides and herbicides. Most species are driven to extinction because we're taking their land and cutting down the trees to make cropland and grazing land for beef. And the majority of carbon dioxide, methane, and nitrous oxide pumped in the air are coming from large-scale animal agriculture and the fossil fuels burned to keep meat cold, to transport meat, etc. This is the main problem, and it's the one thing we could fix. Everybody on planet Earth could go plant-based tomorrow, and they would reverse everything. The truth is, we cut the throats of 80 billion living creatures every year, all breathing out carbon dioxide and methane. And I tell you that this is why the ice caps are shrinking. And, you know, oh, it's the trucks on the road. What's in the trucks? The entire agriculture industry is in those trucks. And it's fine to focus on the health effects. But if you don't have a livable planet, it doesn't matter what your cholesterol level is. And we need to talk about why these bears are on this iceberg, because of our voracious appetite for animal flesh. Well, let's eat fish. We are clear cut in the oceans. We are strip mining the ocean. It's time to let the ocean heal. We've used fishing up. It's time to let the oceans heal. We've used flesh production up. We've used meat eating up. I urge you, go to the website called Comfortably Unaware and read Dr. Appelander's books, see the videos there. This is right where the meat and dairy industry want us. It's completely unaware. Keep eating those burgers, everything's fine. It's not fine. Educate yourself about this issue. It's time to leave caveman thinking behind. If we, the lights are flashing. Individuals who want to be healthy, adopt a plant-based diet. And Homo sapiens as a species, you want to survive, adopt a plant-based diet. If we did, on a species-wide level, we would need so much less land if we grow plants and eat the plants directly instead of feeding them to the animals and then eating the animals, that there would be room for, we need about a quarter of the land. The forest could come back in previously forested land. And as the trees grow, they take carbon dioxide out of the air. The forest would come back, the greenhouse gases would reduce, the soil erosion would stop, the rivers would run clean again, the land would be healthy, the people would be healthy, there'd be money not spent on bypass surgery to send people to college, put internet in everybody's house. It would change everything to adopt a plant-based diet, to order the bean chili instead of the beef chili. What for that small little change, what huge benefits we would get. It's not too late, it's not too difficult. If you haven't seen a video called Forks Over Knives, see it, it'll change your life. The fork is your dinner fork, the knife is a scalpel opening your chest. You'll see people adopting plant-based diets, getting healthy right before your eyes. Then go back to their website. They've got wonderful meal plans and transition plans. They will take you by the hand and help you make this transition. Go to the Physicians Committee for Responsible Medicine, PCRM.org, and sign up for their 21-day vegan kit start. Every day in your inbox, you'll get guidance and recipes that make it really simple. Here's UC Davis promoting plant-based eating. Here's Kaiser Permanente telling their doctors to get your patients on plant-based diet. Doctor said, well, I don't know anything about nutrition. I don't have time to do this. I don't get paid for it. You don't have to, doctor. There are plant-based dietitians who will do that counseling for you. We've ignored the dietitians till now. Bring them onto the team. They make everything run. Just do a search, seek and ye shall find. You will find plant-based dietitians everywhere. Here I give a talk in Connecticut. Here they are in Houston, Texas. Here are Ann Arbor, Michigan, Broward County, Florida. Seek and you shall find. There's plant-based dietitians everywhere. Send your patients to her or him. Let them do the counseling. You just see them back for the follow-up. San Diego. When we're through, gear up the recording again and come back to the slide. Each of these are websites that are educations in themselves. Go to nutritionfacts.org, go to Dr. McDougall's website, read his newsletter, go to Dr. Furman's website. This will educate you into the vast, wonderful, powerful world of plant-based nutrition. The University of Winchester in the UK has a 6-week online course in plant-based nutrition. Take this course, know the science behind this, why it works. I just did a master class, a 12-unit master class on using plant-based nutrition in the clinic. You can take that course. At PCRM, they've got wonderful resources available. If you click on For Physicians, you get You get their free CME. Here's for weight control. Here's type 2 diabetes. Here's reversing heart disease. You can download their nutrition guide right on your cell phone. So if you have a patient with lupus or colitis, punch in lupus or colitis, and here's what they ought to be eating. You can make a career of this. Here's my friends up in Rochester, New York, doing lifestyle medicine and getting people healthy. They're the happiest doctors because their patients get healthy. The Plantrition Project, Google this and join. These are plant-based doctors from around the world. They've got online and in-person healthcare conferences. I'm speaking at one tomorrow online. Here's the American College of Lifestyle Medicine. Please, no matter what your specialty, join this wonderful organization. They have wonderful CME programs, resident programs, medical student programs. Internationally, is the Physician Association for Nutrition in every country. So we're at the end. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And my job is to tear this curtain down and say, look at what your patients are eating. There's not etiology unknown. There's more stuff to learn, but it's the food, it's the food, it's the food. And so at this point in the lecture to the med students and the young doctors, I ask a provocative question. Knowing that most of the major diseases that kill most of our patients and take up most of our professional time and energy are reversible with a whole food plant-based diet and healthy lifestyle changes, you want to heal these patients or don't you? I mean, really, why are you going into the healing professions? Why are you going into medicine? Why are you going to dentistry? Any of these things? Why are you healing these patients or don't you? Then get real about what they're eating. Their heads won't explode. Approach respectfully and creatively with lots of delicious food. People can and do change. So, the era of applied nutrition-based lifestyle medicine is dawning, thank heavens, and the plant-based wave is breaking. So line up your surfboard. I'm the happiest doctor I know. My patients get healthy right before my eyes. You can become the happiest doctor or dentist or podiatrist or optometrist or nurse or dietitian or OT, PT, pharmacist. These are all professions where you've got that moment to be a good teacher, to set a good example, to give the handout, to talk to people, even if it's just they just came to your occupational therapy practice or your pharmacy. You've got those few minutes to say, hey, I'm concerned about you here, and give them my handout and say, well, come on back and let's talk about this. Every one of the healing professions can make a big difference. You can save somebody's life with a concerned word and an appropriate handout. We have a Slack community. You're welcome to join us and join our plant-based clinical forum. Once a month, I lead a forum on plant-based nutrition, and we've got one coming up Sunday night. Go to drklaper.com, plant-based clinical nutrition -forums, and join our forum. We'd love to have you there. So this is what I wish I learned in medical school about nutrition. I wish somebody had put this information in front of me. Would have changed every diagnosis I made, every treatment plan I made. Now I share that information with you. So I was asked to come up with 3 polling questions. I can let Ellie and Susan take this part, but my questions are, what's the most surprising, interesting, or concerning fact you encountered in this presentation? Does this presentation change your viewing of your intended profession? Is there any aspect of your own diet that you might consider reconsidering in light of this presentation? So with that, I will end my presentation. I will stop sharing and turn it back over to Ellie and to Susan. Thanks for your attention. A lot of stuff, but I think it needed to be said.
Thank you. Thank you so much for that presentation. So in regards to the polling questions, I would love if you guys would answer those in the chat. So maybe just go ahead and drop in the chat, what was the most interesting or concerning thing that you learned from listening to our professional today. So yeah, go ahead and drop that in the chat. And while we're going here, we'll also begin our Q&A portion of this session. So we have been compiling a list of all of the questions that were asked in the chat today, but I would love for you guys to ask your questions for yourselves. So if anyone feels comfortable, please use the raise hand function at the bottom of your Zoom screen, and you can go ahead and ask your question for yourself. So I'll start with some of the ones that we've compiled. And then if at any point you feel comfortable and you want to jump in, we'd love to hear directly from you, because my voice gets tiring sometimes. But we'll go ahead and start off with one of these questions that were asked early, and that is, does everyone need to eat 3 meals a day, or is it better to maybe eat 6 small meals in a day? Is there a preference for how often someone eats?
Oh, fascinating question. And if you're a young, growing person, and most of you are, listen to your body. And if it feels good to eat frequently during the day, absolutely do that. You find as people get older, they wind up eating less and less. Most of my contemporaries were eating like 2 big meals a day. If you're not hungry in the morning, it's okay just to drink water till you get hungry. It's a lot of folks just blow past breakfast, have a big lunch and a supportive dinner. And the problem with eating all day if you've got a patient who's obese and diabetic, and they're eating especially flour products, breads, etc., all day, they're keeping their insulin levels up all day. Insulin's supposed to go up and then come back down. But if you're eating all day, you're walking around with high insulin levels all day, and that's going to make you store fats and make weight loss much more challenging. So for your patients that you're working with overweight, diabetes, high blood pressure, not so great. They should eat just a few times a day. But you guys, if you're normal weight and you're a growing, active, athletic person, by all means, you're really growly, have another hummus sandwich or another bowl of chili and enjoy that. So listen to your body.
All right, thank you. So another question that we had was just in regards to diets for certain health conditions. So I've heard that, the keto diet was developed for epilepsy. So do you feel that different non-plant-based diets can be beneficial with certain health conditions like epilepsy?
Very few, essentially no. This is an abnormal, no other hominid, no gorilla eats flesh 3 times a day, no bonobo, no other primate does this. And we didn't used to do it either until we got rich after World War II. This is not a natural diet. And the folks who are doing the epilepsy thing, these poor kids, and these are the ones that are having major grand mal seizures every 20 minutes. You got to do something for them. And so they put them on this diet, but all of the pediatricians are looking at each other. What are we doing to these kids' arteries? What are we doing to their cancer risk? What are we doing to their bone marrow? This is not, they're going to wind up on dialysis. This is not a normal, healthy diet for these kids either. And 5-10 years of being in ketosis is hard on the bones, hard on the liver. This is not just because it had has some benefit in this weird, strange condition there. You can't say, oh, then it's healthy for us. Let's everybody eat keto. This is a state of acidosis. These ketones are acidic. We're talking about beta-hydroxybutyric acid. We're talking about acetoacetic acid. We're talking about acid. This is a constant acid load. There's your kidneys you have to deal with, your bones you have to deal with, your liver has to deal with. This changes the entire physiology of chemical reactions throughout the body. And nobody's been in ketosis year after year after year like it's being proposed here. And I got a feeling this is going to unleash some nasty diseases here. So the answer to the question is no, we're plant-eating hominids, we are. Do you have to be 100% vegan? No, and if you have a little meat once or twice a week, lightning probably won't come out of the sky. But we can't kid ourselves that we are carnivorous apes and we got to keep ourselves in ketosis. Fats in our Paleolithic time are very rare. Where did you find fats? Out on the African savanna? Maybe if there were coconuts at the coast, or a dead carcass in front of you. Most of the game animals were lean, wiry, muscular creatures, very little fat. To say that we ate fat all day and kept ourselves in ketosis is a fantasy. And when you look at the large fecal droppings from our Paleolithic ancestors that have been fossilized, the coproliths, you see the massive amount of fiber these people were eating. They spend all day foraging for these starchy roots and tubers and edible grasses. That's what fueled the Paleolithic folks, not mammoth meat. So the idea that a flesh-based diet keeping you in ketosis is somehow helpful is a fantasy. It's a rationale for, because we like to eat more steak, but don't think it's doing good things for inside. And I'm afraid as the diseases start showing up, we've already seen. They Google paleo diet and TMAO and watch the high TMAO levels these paleo folks are walking around with, and follow them along for another 5 years, 10 years. See the incidence of strokes in these folks. I think it's going to be, they're going to have a lot of justifying to do.
All right, thank you for that answer. Definitely interesting to think about. So another question that we had from the chat was about intermittent fasting. So for example, keeping all meals within 8 hours of each other. Do you have any opinions on that style of eating?
Oh, I sure do. And it's a wonderful thing to do. As I mentioned early on, we eat all the time. We keep ourselves postprandial all the time. It's not a healthy thing. Our insulin levels stay up and our guts never stop working and spawn some strange microbes in the gut. Back again, 1 million years ago on the African plain, you can imagine that not infrequently 4 or 5 days would go by before your little foraging band found the next berry bush with fruit on it. And these intermittent fasts were probably the rule. And our body learned how to shift into a gear of burning your own stored fatty acids. And good things happen. There's inflammation goes down. The cells start cleaning themselves out, called autophagy, where they start burning scrap starches and protein fragments to throw into the metabolic furnace. And this leaves the tissues healthier and more vibrant. The antioxidants increase during fasting. And this happens while we're sleeping. Every night we fast. That's why the first morning, the first breakfast, the first meal in the morning is called break fast, because we're breaking the fast. But if you don't break that fast, now you don't go into ketosis overnight, but the wheels are already starting to gear up metabolically to get you into ketosis. And if you, instead of running down to the table at breakfast time and stuffing your face full of carbohydrates, and if you're hungry, by all means, have a cantaloupe, have breakfast. But if you're not really hungry, that means your body's happy burning that nighttime fat-rich fuel. And the folks advocating intermittent fasting are saying, keep that state going for the morning hours instead of breaking the fast at 7 or 8 in the morning. Keeping that fasting state all the way till noon. So you get an extra 6 hours of autophagy and antioxidant production and cell stabilization. All those good early changes in fasting happen day after day after day if you do that. So it's turning out to be a very helpful thing. We need to follow these people along 5 years, 10 years, 20 years to see what really happens to them. But from what we can measure now, it seems to be a very reasonable thing to do. And so if you're into it, see how it makes you feel. Wait till noon before you have that first salad or soup or whatever, and see how you feel at 11:30. If you're feeling light and healthy, then you might want to continue that on a regular basis.
Awesome, awesome. So another question that we've been getting often is in regards to the Mediterranean diet. So I know that I've heard a lot about those areas with high numbers of centenarians and how it's often a Mediterranean diet with maybe like a lot of olive oil, a lot of fish. Are you a proponent of that diet?
Definitely not. And turns out, and if you go to the PCRM.org website, there's a good study there on Mediterranean diet and heart disease. The truth is that people on this diet in the PREDIMED study, they all continued putting on weight. And there was an atrocious incidence of heart attacks and strokes in both groups, the olive oil group and the nut eating group. They both had an atrocious amount of stroke and heart attacks. None of them had reversal of their disease. None of them had their plaques melt away. They were all getting fatter. There's no way can this be healthy. Ooh, Mediterranean diet, olive oil, like the olive oil is something magic. In the Lyon heart study, they said the Mediterranean diet was healthy in spite of the olive oil. It's because it's a vegetable heavy diet. That's the magic, in the Mediterranean diet. It's full of veggies and pastas, very little animal flesh. So people say, oh, it's the olive oil. It's not. There's liquid fat in a bottle. And so people continue getting fatter on that. I'm not a big fan of Mediterranean diets. It should be a plant-based diet.
All right, thank you. Definitely interesting to hear that perspective. I've always heard a lot of good things about the Mediterranean diet, so important to look critically.
Yeah, it's better than Big Macs and Whoppers twice a day and the standard Western. Yeah, beats the snot out of that. I agree. But if you're talking about diversion disease, about creating lean, healthy people with low incidence of diseases, you want a plant-based diet with Mediterranean-ish. You want to shred a little bit of chicken flesh onto a salad. Well, that's up to you. But again, it should be a plant-based diet.
All righty. So another question that we had, and I believe this was in regards to the slide about the effects that eating meat has on your body. And somebody was asking, do dairy and eggs have those same effects?
Oh, they each have their charm. There's real problems. The milk of a cow is full of estrogens. The cows are all pregnant now in the dairy, and so the milk is full of estrogens, and it's a major reason why our little girls are going through puberty at age 8 and 9 and 10 from all the milk and cheese and ice cream and yogurt they are eating, full of active cow estrogens. These are active mammalian estrogens. These are not the puny little phytoestrogens in soy. This is estrone, estradiol, estriol, pregnanediol, progesterone. This is what's in the milk of a pregnant cow. And they're all pregnant in the dairy now. And so that's in every glass of milk and container of Greek yogurt. The milk is full of IGF-1, which the mother cow wants to give to the calf. But again, the more dairy a guy eats, the higher his risk of prostate cancer. A woman with a breast lump who eats baby calf growth fluid full of estrogens and growth factors, notice that her breast lumps get bigger, her fibroids get bigger. The cows get leukemia. The American dairy herd is full of leukemia, bovine leukemia. That winds up in the cow's milk. The antibiotics that these cows are fed winds up in the milk. It's dirty stuff that's full of hormones and growth factors and allergenic proteins that sort of asthma, eczema, acne, as you saw there. It's for baby calves. We have no more need for the milk of a cow than we do the milk of a giraffe or the milk of a moose. Would you pour dog milk on your cereal? The fact that we think that cow milk is healthy, it's bizarre. You get your protein from your beans and get your calcium from the green vegetables, which is where the cow gets her calcium. They don't drink milk; they get it from the greens they eat. So the dairy is, when people stop eating dairy, they lose that bloat out of their face, their skin clears up, their guts work better. Feel free to stop the dairy. You'll be better off without it. And eggs are full of choline and cholesterol that sets off TMAO production and atherosclerotic changes. There's nothing healthy about eggs of chickens. Can somebody handle a little bit of whatever cheese or yogurt? Yeah, the dose makes the poison, as you'll learn in toxicology. And tiny amounts for flavoring. I'm not advocating it, but you can get away with a small amount. But to think it's an essential part of your diet, and you've got to have that dairy for your bones, and you got to have the chicken eggs for some reason, you don't. I've been eating them for 40 years now, and haven't done me any harm. So you're better off without the dairy and the eggs. Eat a plant-based diet.
Another question that we had was about food deserts. So for individuals that maybe don't have access to a grocery store to get these plant-based foods on a regular basis, and how do you think that they can make a change in their life, and how can we better serve them?
Thank you. Such an important question, because that's a real thing. And the food desert in this country is reprehensible that we've allowed that to happen, but it does. So a couple of things. I gotta beat down a widespread misconception that, eating this way is expensive. And an arugula costs, listen, that's nonsense. The staples, where you get your calories and your protein, are cheap. You can buy a 20-pound bag of rice for $8. You can buy a 15-pound of lentils or beans for $12, and they last for months and stored properly. and you can make all sorts of soups and stews and chilies and curries, etc., with grains and legumes. The staples are cheap. And if you're not shelling out money for T-bone steaks and premium ice creams, etc., you got a few bucks to buy some organic broccoli or some kale. So this idea that it's expensive, it isn't. Peasant food is cheap. It's called that for a reason. But the rice and the beans and staple, they're cheap foods, and everybody should have access to them. Now, it is atrocious, these actual food deserts. And some of my, I've got a surgeon friend and an ER doc, and they spend their Saturdays going to farmers markets. And at the end of the farmers markets, they buy up all this stuff that hasn't sold really cheap, load them into their 2 pickup trucks, and take them back to their neighborhood where the food deserts are. And they give it away, or they sell it for pennies on the dollar. And they're practicing one of the highest forms of medicine in their blue jeans and pickup trucks, because they're really helping these people. No one says in medicine has to have a white coat and a stethoscope on. And doctors need, and nurses and all these folks need, and the administrators need to take an active hand and abolish the food deserts, educate the people and get the veggies to them, either start community gardens, bring in produce trucks, start a farmer's market. There's ways to come around this, there are workarounds on this that are screaming to be worked around. But don't say, it's expensive, we can't afford it. Next, I'll go to McDonald's instead. That McDonald's burger is cheap because we are paying tax subsidies to the beef industry and the dairy industry and the animal farmers. If those burgers really sold for what it really costs to produce them, if they had to pay for all the water they used, all the soil that erodes, all the greenhouse gases that are put in the air, the burgers would cost $50 a piece. Nobody could afford them. The talk about food deserts, the real expensive foods are the flesh foods and the dairy on the docket. It's not the rice and the beans, that's for sure. So we need to see how what we're really looking at here and do whatever we can do to fix the problem, but it's fixable.
Thank you. And I love that story about those doctors bringing out produce to those communities. That's amazing and definitely a good step in the right direction. We are getting close to the end of our session today. So I just want to ask you for any last minute advice for us as future healthcare professionals before we go into our wrap-up presentation.
Oh, well, thank you. Well, it's good to the philosopher say, what you know about, you see. You now know about this, and you see this huge, huge central role that the patient's diet is playing in all these diseases, no matter what you go into. You're going to be dealing with dietary disease. Just knowing this will hopefully not only help you understand the diseases you're seeing, but it becomes a self-solving problem. You know what to do about it. It's get them folks eating healthier and all the other lifestyle changes. So it's an exciting time. We now know this. When I was your age and going into med school, I didn't know any of this. I still didn't, for years to come. This is a time when you can see so much, do so much, know so much. I'm envious that you're starting your careers now. It's a wonderful time to be in the healing professions, no matter what you choose, which aspect of them you choose. So set a good example. Eat healthy yourself. Eat a predominantly, if not completely, whole food plant-based diet. Get as active as you can. Get enough sleep. Get enough laughter and love in your life as much as you can. But have a clear image of what your patients are bringing to you and imaginative ways to help them. And you'll wind up the happiest doctor you know, or the happiest pharmacist or dentist or nurse, whatever you decide to go into. At the end of your day, you'll say, yes, boy, that Mr. Smith came back to me. I didn't see him for 3 months. Man, he's lost 18 pounds. He's off his meds. He looks great. Yes. And man, that's how you want to feel at the end of the day. You're really helping people get healthy. And that's the calling that we're all trying to answer. So thank you for this. This has just been wonderful. It gives me hope. You guys give me hope. And there's a lot of us docs rooting for you. And we're available. Call me anytime. And when you get into med school and into the clinics, seek out the doctors who are aware of the power of applied nutrition, especially the plant-based nutrition, and shadow them. And you'll see some patients really get healthy. So all the best to you. Thank you again. And let me know if I can be of further help. Have a great time in your career. It's the best career in the world, whatever you're going into in the health professions. Take care. Good luck.
Thank you so much again for this wonderful insight. I think that we'll all carry this knowledge with us forward and hopefully make our patients' lives better. At this time, we are going to go ahead and go into our wrap-up presentation. So I do invite you to log off if you don't want to listen to that, but thank you so much again, and we're all so appreciative. So moving into the portion of our session where we will tell you about how you can certify your hours today for anybody who takes our quiz. First off, I just want to encourage everyone to reflect on our session today. So you can just think about, what brought you here and what are 3 major takeaways that you pulled out and what do you want to learn more about. And so this writing is not required, but if you do want to write this reflection down, we do encourage you to submit it to our website for publication in recognition of your hard work and to enhance your future applications. I would also like to just mention again that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research in a plethora of topics, fields, and locations. This program is 100% remote, which means you have the power to connect with anyone. This is an 8-week program that will begin on June 21st. For more information, please fill out the interest form sent in the chat below, and we will get back to you as soon as possible with additional details. If you want to learn more about pre-health shadowing and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. We're also accepting team member applications if you want to take on a more active role in PHS to lead projects and initiatives and be up here with us. Once again, we do humbly ask that if you're financially able to donate, you please consider sending a few dollars to us via Venmo or PayPal. It does cost a lot to keep our program up and running, but we want to keep this free to all of you. So if you can afford to, or if you know someone who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask that you spread the word about pre-health shadowing so that we can reach as many students as possible. And now for the part that I know we've all been waiting for, earning a digital certificate for the virtual shadowing hours from this session today. So the first thing that you're going to want to do is go onto our website and find our professionals course page. Next, you can take a quick 10-question multiple choice quiz based on the content from the session today. You will have 30 minutes per attempt to earn a 70% or greater to get your certificate. We know that sometimes technology can be difficult, and for this reason, we do allow 2 attempts to take the assessment, but if you run into any difficulties, please contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting 30 minutes to an hour after the session to take the quiz, which will be open indefinitely. And lastly, once you have passed your quiz, you can click the Finish Course button at the bottom of the professionals page and download your certificate that verifies your virtual shadowing hours. If you missed any part of this session or you want to go back and view any of our other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find them via the professional pages on our website and take the post-shadowing assessments for those as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. We are currently booked every weekday through June for virtual shadowing sessions, and I hope to see you guys there. Thank you for joining us today, and please stick around if you have any questions for myself and the other team members, and we'll be happy to answer them. This shadowing session is officially over, and I invite you all to log off. Have a wonderful day.